FibroScan is a fairly new technology. It's based on a principle called transient elastography that actually allows us to measure the stiffness or the amount of fibrosis in the liver. The advantage of FibroScan is that it is completely non-invasive without any risk to the patient in terms of pain, bleeding that you would get, for example, with a liver biopsy. For the majority of our patients, FibroScan actually is replacing liver biopsy. The FibroScan is extremely accurate for the majority of patients and gives us a stage of liver disease, so it correlates very well with what we would get from a liver biopsy without the risks and without the discomfort to the patient. FibroScan is really exciting for providers because we're able to offer our patients really sort of a state-of-the-art revolution in liver diagnostics, in that we can tell them exactly what stage of fibrosis or liver scarring they have on the same day as their clinic visit. And we'd be able to give them a score and an interpretation of the results really during that clinic visit.
You're here today for a FibroScan, is that correct? Mm-hmm. Okay, so what we're going to do is I'm going to have you lie back and we'll lift your shirt up and start the procedure. It takes about 15 minutes. So this procedure is non-invasive, and we'll have the results as soon as we complete the procedure, and we'll print you a report which you'll be able to take home with you. So this is the probe. We're going to put some ultrasound jelly on your skin. It's going to send a vibration into the liver. The machine then calculates a score, which will be represented here in kilopascals, and that will equate to how much liver stiffness you have or fibrosis. And then we can stage your liver 0 to 4. 0 is a normal healthy liver and 4 is cirrhosis. So we're just going to put your arm up above your head and shift your legs to the left. And then we're going to find where your sternum ends here and then find a line to the mid-axillary point, which is where we're going to put the probe. I'm just going to use a little jelly, and then we're going to do a series of 10 of these measurements to get the calculation. Now that we have 10 valid measurements, procedure is over, and your final score is 5. That's representing kilopascals, like I have said, and the IQR, that's the interquartile range, is 16%. As long as this is below 30%, it's valid, but we like to see it less than 21%, so this is a good test. And then we can talk about what this means. With a score of 5.0 kilopascals in your individual health history, this means that you have stage 0 or no fibrosis, which is great. Okay.
I like to tell my patients that FibroScan is a really exciting new technology that offers us a way to stage or decide how much liver fibrosis and scarring that they have without causing them any harm or any pain, and allowing us to give them an answer day of.